Good morning, everyone. Thank you for being here today. Today, I and my supervisor Autumn will talk about our research for you. Today, we would like to introduce our research from gardens to well-being, and it's about how social and therapeutic horticulture supports mental health in residential care homes. This work is based on a study conducted in Scotland, and it focuses not only on whether horticulture is beneficial, but more importantly on how it works in real care settings and what makes it sustainable in practice. One key idea we want to introduce from the beginning is this. Gardens do not automatically become therapeutic just by existing. Their value emerge when residents, staff, environment, and organizational culture work together. Next slide, thank you. To begin, I would like to briefly introduce the broader context of this research. Globally, we are seeing rapid population aging. By 2050, more than 1.6 billion people will be 60 or over, and that means increasing pressure on healthcare systems and social care provision. In Scotland, this trend is also evident. Around 20% of the population is now over the age of 65, and many older adults live alone. As a result, demand for long-term residential care continues to grow. However, beyond these statistics, what really matters is the daily lives of older people in care home. Many residents experience loneliness, low mood, and limited opportunities for meaningful engagement in daily life. Even in well-resourced settings, routines can become highly structured and passive. In response to these challenges, there has been increasing interest in non-pharmacological and person-centered approaches to care. Among these, social and therapeutic horticulture, or STH, has guided attention as a nature-based intervention that combines meaningful activity, social interaction, and contact with the natural environment. However, despite strong policy support and growing interest, STH is still not consistently or meaningfully implemented in many care home settings. This gap between recognized potential and actual practice forms the starting point of our study. Next slide, thank you. And then we do some literature reviews. We found existing research on STH has largely focused on outcomes. For example, many studies have shown that gardening activities can reduce depression, improve mood, and enhance well-being. However, there are still important gaps in the literature. First, there is limited understanding of the mechanisms through which these benefits are produced. In other words, we know that it works, but we do not fully understand how it works. Second, there is little attention to the practical conditions that enable or constrain implementation in real-world care settings. Third, the experiences of care staff and the relationship between staff well-being and resident outcomes remain underexploited. Therefore, this study shifts the focus from asking, does it work, to asking, how does it work, and under what conditions can it be sustained? Based on this, the study had two main aims. The first aim was to explore the mechanisms through which STH supports mental well-being among older adults in care homes. The second aim was to identify the conditions that influence the successful and sustainable implementations of these activities in practice. Okay, next slide. Thank you. To explore this question, we use a qualitative approach with two main parts. First, we conduct a narrative literature review. This helps us bring together existing research, identify key themes, and build a clear understanding of how horticultural interventions are thought to support well-being. Second, we carry out semi-structured interviews. We spoke with care home staff and practitioners across Scotland, including care staff, managers, activity coordinators, and therapeutic horticultural practitioners working in different residential care settings. In these interviews, we explore several key areas. What gardening practices are currently happening? What benefits staff see for residents? What barriers get in the way? And what could help make this activity more accessible and sustainable? All of the interview data were analyzed using semantic analysis. That means we look for pattern across the interviews, compare different perspectives, and develop things that reflect both sharing experiences and differences between settings. Importantly, by combining the literature review with the interview data, we were able to connect theory with real-world practice, giving us a more complete picture of how STH works in care homes. Okay, next slide. Thank you. And from our analysis, we identified four cognitive findings. First, participation is not a simple yes or no question. Residents move along a spectrum from seeing to engaging. Second, benefits emerge through two pathways working together: natural contact and social interaction. Third, barriers operate in layers, including environmental, organizational, and cultural factors. And finally, sustained use depends on routine integration, accessible design, and care culture. In the following sections, Autumn and I will walk through these findings in more detail. Okay, next slide. Thank you. So our first finding is about participation. What's really interesting is that engagement with gardening isn't just a simple yes or no question. It's not about whether someone joins in or not. Instead, it happens along a spectrum. At the most basic level, residents may have passive contact with the garden. They could be looking at the garden from indoors, sitting outside, or just enjoying the sunlight and fresh air. Then, at a more active level, they may do some light gardening, watering plants, sowing seeds, and or other simple tasks. And at the highest level, there can be structured programs where residents take on responsibilities, set goals, and take part in regular group activities. Now, here is the key point. Even passive engagement has meaningful benefits. Just being near nature can help people relax and feel better emotionally. But moving along this spectrum doesn't happen automatically. It depends on a few important factors, especially visibility, accessibility, and staff support. Like one participant put it very clearly, if they can't see the garden, inviting them is like asking them to go to Mars. That really says it all. The garden needs to be not just physically there, but also psychological accessible. If residents can't see it or even imagine it, they are very unlikely to engage at all. Next slide, thank you. So we have seen that participation exists on a spectrum from passive contact to construct programs. But what actually happens when residents engage, even at the passive level? What makes it work? That leads us to our second key finding, how STH supports well-being. We identified two main pathways. The first key mechanism identified in this study is the natural-based pathway. Gardens provide a multi-sensory environment that can stimulate sight, smell, touch, and movement. These sensory experiences can have immediate effects on mood and psychological functioning. Participants report improvements in mood, appetite, sleep, and overall emotional stability among residents. Exposure to natural light and fresh air was also seen as particularly beneficial. In some cases, even brief visits to the garden results in positive changes. As one staff member said, they may forget the reason later, but that moment is really happiness. This highlights an important point. Even when cognitive memory is limited, emotional experience remains meaningful. The value of STH is therefore not dependent on long-term record, but on immediate lived experience. Okay, the second key mechanism is the social interaction pathway. Gardens were described not only as physical space, but also as social environments that facilitate interaction in a natural and low-pressure way. Residents who may normally remain quiet or withdrawn indoors were more likely to engage in conversation when outdoors. Shared activities such as planting or simple sitting together provide opportunities for connection. Importantly, some residents did not participate in gardening because of an interest in plants, but because of the social opportunities it creates. As one participant reflects, I don't actually like gardening, but here I learned how to interact with people. This suggests that the benefits of STH are not limited to the activity itself, but extend to the relationships and interactions that enables. Importantly, those two pathways do not work separately. They reinforce each other. Nature provides a low-pressure environment, while social interaction make the experience meaningful and repeatable. This is very important. It shows that the benefit is not only about gardening itself, but about what the space enables socially and emotionally. Okay, that's all from me for now. Now I'd like to invite my supervisor, Autumn, to take over and share the next part of our funding. Autumn, over to you. Thank you.
Thank you, Zoe. Hello, everyone. Yes, next slide, please. Okay. Yes. So we've been hearing about the kind of mechanisms and pathways for residents themselves to get benefit from therapeutic horticulture. But it's really, really important that we also think about the value to the staff themselves. And this is something that sometimes gets forgotten about. So in Scotland at the moment, we actually have a bit of a workforce crisis in social care. We don't have as many skilled available workers as we need. And a lot of residential homes for older people are understaffed, or there's a lot of precarity around staffing. So it's really important to think about staff well-being, how we can retain good staff, how we can make this important work with our elders better for them and less stressful for them, and more inspiring for them. So what our study found was that being able to support residents outdoors had a number of key benefits for staff. So one was an obvious one, that if you have happy residents who are sleeping better and eating better and feeling better because they're outdoors more and they're in the garden, then you're going to see a difference in mood and behavior. And actually, that makes the job easier for the people who are trying to care for them. Because some of the behavioral issues and challenges that the residents might face are actually because they're unhappy, they're not feeling well. So happier residents, as this quote from one of our respondents say, residents are easier to care for when they're happy. And if they're in the garden more, then they're happier. So that has a benefit to staff. So the well-being of staff and the well-being of residents is interconnected. It's a circle. So we have to think about both together. And obviously there's a virtuous circle here. So the calmer mood from residents and calmer mood among staff allows for stronger and deeper relationship-based engagement between residents and staff, and allows relationships to develop. So in Scotland, we talk a lot about relationship-based practice in social care. So the importance of knowing the people you work for, genuinely knowing them, and feeling that care and warmth between them. And residents say that that's what they want, and that's also what makes the job good for the people who are doing that job. So the garden provides a context to strengthen those relationships, which follows everyone back into the building as well. And then obviously, if you're enjoying your job, you're more likely to kind of stay in the work and give more to the work and feel more able for the work. So that is reinforced as well. And then all the physiological and psychological benefits that residents experience, also staff are experiencing. So social care can be quite a stressful job. It's a very physical job. So getting outside, having fresh air, having a moment of connection with nature, but also with residents is good for staff's well-being and health. So I think overall, the benefits are huge for staff and residents, and you can see that in this slide. Can you move to the next slide, please? Okay, so having said all these wonderful things, we also have to acknowledge that this isn't easy always, and there are a number of barriers that we explored in this study and that have been looked at in other places in research. And I think if we're not honest about the barriers, then we can't find strategies to engage with that. So we love our beautiful Scotland. We get lots of rain here. It's very, very green. But sometimes weather and seasonality is a challenge. And part of that is helping staff to think about how they can respond to that weather and be a bit more flexible sometimes. But we have to admit that if it's really cold, it's really wet, we don't want to be always taking our older residents out. We don't want them to get unwell. So that can be sometimes a bit of a challenge. Another barrier that we have to acknowledge is accessibility and design. So not all the gardens that are around make it easy to get out with a wheelchair or make it easy for people who might be using a walker. But as Zoey said, it doesn't always have to be about being right out in the heart of the garden. Sometimes sitting at the edge of the garden can be a really beneficial thing as well. But we do have to acknowledge that not all the gardens have got high beds that would enable people to do a bit of digging or planting. And there can be a lack of seating or shelter in some gardens, which makes it more difficult. So we need to think about gardening design if we want to encourage our residents to make better use of the garden and staff to encourage residents out. Another key issue, which I've already kind of touched on when I've talked about the crisis in social care in Scotland and in other places, is the care processes and pressures. So it can be really difficult if you're just trying to get through all the basic tasks in a day of making sure everybody's basic physical needs are met, and you're understaffed and you're having to move quickly through a lot of different tasks. Getting out into the garden can feel like just an inaccessible kind of luxury. You might want to do it, but it just feels like there's no time in the day to do that. And we'll talk a bit about how maybe that could be addressed in some ways. And then the last one, which in some ways, in some places is the most significant barrier, is a risk-averse culture, which we talk a bit about in social work generally, in all sorts of settings of social work, how sometimes our mindset about wanting to be protective and prevent risk means that we can overdo it, and we limit opportunities for new experiences or beneficial experiences because we're too focused on the possible risks. So we definitely need support from inspectors and other regulators to kind of encourage staff to feel like it's okay to do some of these things that maybe do have a little bit of risk, but the benefits far outweigh the risks. And I think there was a really good quote here from one of the participants who said, "The doors are always locked, so even the most beautiful garden is meaningless." So I guess the point being that if we don't enable people to get out, if we don't make it accessible and move a bit away from our worries about that, then it's not going to happen, and the garden's not really any use to anyone in that case. So a garden can physically exist but fail therapeutically if residents cannot safely and routinely reach it. So it's a kind of core message here, and we do need to think about how we address some of these barriers. Next slide, please. Okay, so it's not all doom and gloom because there are lots of facilitators as well. So we need to think about at an organizational level, is there leadership that believes in the value of gardens, that has seen the evidence, realizes the benefits both for staff and for residents, and makes a kind of commitment to encouraging a culture where we're getting outdoors and we're getting in the garden? So I would say that in some ways that's the most important facilitator, is people who really believe in it and are willing to encourage it, and have a positive risk culture, and also think about how can we build it into the routines of this place. So can we have our morning tea routine outside? Actually, maybe that's not as difficult as we think it is, and really encourage people to think about how to do that. So organizational culture and practice is kind of the key top level facilitator. And then at the environmental level, obviously, we've got to think about all the things outdoors that can make a difference, like the seating, raised beds, shelter, all the things I spoke about earlier, and trying to find ways maybe through working with families linked to the home, or looking at small grants locally. And Trellis has a lot of advice and support and materials about kind of thinking about how you might get help to make some adaptations and develop your garden. So you could also seek support from Trellis around some of these issues. And then thinking about the staff and the family level. So, encouraging and prompting people to make use of the space. And families can be part of that as well. I know when my father-in-law was in a residential home, every time we went to visit, we would say, let's get him outside. Let's go sit in the garden for our visit. So kind of getting into a habit of seeing that as a space that everybody can use, and encouraging that use for staff and family. And then at the resident level, residents, obviously, there's keen gardeners in the resident group, or people who would be if they were given the chance. So trying to find out more about the people who live in the residential home, and maybe there's an interest in gardening that nobody's ever asked about, so there can be leadership and energy in the positive energy towards the garden from the resident group that can be galvanized and accessed as well, if we kind of take the time to ask and to think and to talk about it, and to bring things out, maybe sometimes bring things out of the garden and into the home, to start to pique people's interest, a piece of lavender or a bit of herbs, and start to have conversations that might lead people towards the outdoor space more. And again, there's a lot of advice and suggestions from Trellis about things you could try to bring the outdoors in and the indoors out. Next slide, please. Okay. So overall, we really think that it's important to be thinking about going from just this idea of having a garden to making this a space that's actually usable and relational and embedded in care practice. So we know, for example, that throughout the world, there's a real movement towards perspectives around human rights and a right to nature, and access to nature being a basic human right. And I think we need to kind of bring a new mindset to residential care for older adults, and recognize that their relationship with the natural environment, with the garden, is just as important as their relationship with, can we go back one slide? Sorry, is just as important as their relationship with people, and these things are connected and can support each other. So as we've kind of talked about, we need to focus on organizational cultures and routines, and try and embed opportunities for the garden into those, and leadership needs to be focused on some of these issues a bit more, to make it possible for staff to recognize their value and to feel able to make suggestions in that space as well. Residents need to be given choice, and their need for being in the garden needs to be recognized. And staff can also obviously support this and get the benefits from it as well. But kind of seeing that as part of their job, and that can actually facilitate and make their job easier, not harder. And then obviously the environment, making it visible and accessible both to the staff and to the residents. So as Zoe's already said, but I just want to say again, obviously, the therapeutic value of gardens is not just about the garden itself. It's this dynamic interaction between the space and the people and the culture, and these two pathways, the nature pathway and the social pathway, are what bring the therapeutic value to therapeutic horticulture, and they connect it and bring it together, and it's a virtuous circle that reinforces itself. And obviously we can make small steps to start with, but there are a lot of inspiring examples in Scotland, and that was one of the joys of this project that Zoe and I found, was talking to practitioners who are really driving this work forward and have a lot of practice wisdom about how to make this work and a commitment to it. So we can learn from these good practice examples, and we can all be champions for gardening in big and small ways wherever we are based. Next slide, please. Okay, so for practice, I think we need to think about really recognizing the individuals that we're working with, that person-centered approach to social care that we talk about so much, but really tuning into the needs and the strengths and the abilities of the people we're working with, and thinking about how being in the garden or access to nature might support those and develop those, and figuring out what's a hook for the individual person or group of people that we're working with. What's going to be their hook into the garden and into the natural space, and providing a whole range of engagement options that meet those needs. So not one size doesn't fit all in social care generally, and it certainly is not the case in social and therapeutic horticulture. So thinking about that. And for the organization, staff are at the heart of good residential care. If we don't have happy, healthy, well cared for, supported staff, we're not going to have happy, healthy residents. So recognizing the connection and the benefit for staff of the garden and the outdoor space, and really kind of encouraging them, and appreciating the value for them as well. And figuring out ways to make access to the garden more routine, more part of the day-to-day, because if it's always seen as an optional extra, then it's something that can drop off the agenda. So it might be as simple as we have our tea break out here, or we always go out, if it's not raining, we always go out in the afternoon for even 15-20 minutes, and over time that can build. So for policy, we really need to think about how we move away from risk aversion, risk avoidance, and recognize that if we don't take risks in life, nothing ever happens, and that our wonderful elders in these residential homes, many of whom have loved nature and been in gardens, need to still have that into their old age. And this is one of the things that makes the final chapters of our life joyful, if we have access to the natural world and to gardens. So we need to center that more and think about reducing our risk aversion. And finally, for future research, there's a lot more work to do in this area. In general, there's not as much research in residential care homes as there should be in relation to a whole host of topics, but especially in relation to gardens. We have an emerging evidence base. We need to develop that, and we need to understand better what particular activities and supports can make the most difference in different contexts, because different residential homes are also very different. So we need to understand the kind of ecology of residential care and the ways that gardening can work a bit better in different settings in more detail. And there's probably room for more evidence kind of around the physiological effects as well, doing more measurement of people's physical health over time, so that we can make a more and more robust case for why this does matter, because we know it does, but the more evidence we have, the better. I think we can move on to the next slide now. Okay, so in conclusion, we're really arguing that social and therapeutic horticulture should be part of everyday care culture and not an optional activity. I'm guessing a lot of people listening to this enjoy the garden. That's why they're here. But if you imagine the ones you love in residential care, or indeed yourself someday, if you ever needed residential care, it breaks my heart to think that I might not have access to a garden, even just to sit and listen to the birds, to smell the grass, all the sensory things that anchor us to this beautiful planet Earth that we share. So we really need to move to this being just the norm, not an optional extra. And that's what this study is really arguing for. And I know much of the work of Trellis is arguing for as well. So it needs to be visible and reachable. We need to recognize this dual pathway, that gardens are social spaces as well as nature places, and that nature can support social connection. And that's one of the really beautiful things about what happens between groups of people outdoors in gardens. We need to support access in all different ways, both for staff and for the residents. And we need to think of this as a routine practice, as I've already said. And moving on to the last slides now. So there's a lot of additional reading that you can do, and we can share these slides with people. But as I said, there's a growing evidence base, and in Scotland, Trellis are really leading the call for more Scottish-based research on this as well. But Trellis is also linked to a whole network of international therapeutic providers, but also researchers in this space. So it's a very special resource, Trellis in Scotland. So do check out their website and connect to the things that are happening here and wherever you are. And now the final slide. Yeah, and there's a lot of very useful studies about horticultural therapy and social and therapeutic horticulture. And we urge you to read more and to think more about these issues. And Zoey and Emma and I, so Emma Martindale was very involved in this piece of work as well, and she works at Trellis. The three of us are currently writing this up for publication, so hopefully we'll be able to post that on the Trellis site in due course. But I think that brings us to the end of our presentation, and now I think maybe we have some time for questions.
Thank you so much, Zoe and Autumn. That was a really amazing presentation. I've enjoyed listening so much. And I think one of the things that really struck me was how very close to implementation in our practice this research was. And it's not always the case. You know, this I could immediately see how we could implement a lot of these points and a lot of the recommendations or the things that seem to work well. We could strive to implement that into our practice, which is exactly what we hope these seminars might do, because we know that not everyone has access to published journals. And even if we do, the research, the literature for this field covers so many different fields, from gerontology to pediatrics to mental health and psychological disciplines. It would be impossible to stay up to date. So that was really something that came across strongly to me. And I just loved some of the points you made that are really in tune with like, as you said, with some of the things we think. You know, that it breaks my heart too to think of people in care with no access to a nice garden or even any garden, and that it needs to be non-optional, as you put it. And so that was really nice to hear that this is also coming out of the research, and that there's a hope, therefore, that we might change policy, we might realise that goal, that we want to see this happening in every care setting, in every school, in every community health setting, in every hospital, in every prison, as standard, as basic. Nothing special about this. This is just what the world is like. That's our big vision. So that was lovely to hear, and great to hear about the focus on mechanisms and practical implementation and the staff experience rather than just the outcome, which you're right. You know, that is the main focus of much of the literature. I love the quote that Zoe shared about, you know, if residents can't see the garden, possibly staff as well, it's like asking them to go to Mars. To Mars, you know, it seems so far away and out of reach. And, you know, so all these ideas about the design of the garden, which is something that is in every practitioner's training, you know, therapeutic gardens practitioner has to look at the design and accessibility. having a view of the garden is ideal if you can manage it in the setting you're in. And if you can't manage that, can you bring stuff in, like you were saying, some sprigs of lavender? Can you have some pots on the windowsill and start the conversation so that people know it's there and begin to want to go out? I'm going to stop rabbiting on because there's so much I could really go for some time. But I'd like to check if there are any questions from the field. I'm not seeing anything in the chat, but maybe some of you have had some ideas sparked or are curious. Now we've got these two researchers here, we can ask them more about the study and other things they found that maybe we could go into in some more depth now. Do we have any comments or questions from the audience? iPhone 2. That's I can't see your name, but you can raise your hand as well. But the first person was iPhone 2, and then I see Mandy also has her name right. Can you unmute and maybe introduce yourself and your actual name, please? Thanks.
Hello, can you hear me? Hello, can you hear me?
Yes, we can hear you.
Yes, we can.
Hi, my name's not iPhone 2, my name's Elaine. And it was interesting to pay attention to the presentations this morning, particularly as having worked in residential care for a number of years, and also been a carer of members of family in residential care, and always been a gardener, and gardening always part and parcel of family members' lives who were in care. I think my comment on the presentation, thank you. It was lovely for me in the opportunity to reflect what's happened over time within the care system. When I was working in residential care in Scotland, it was at a time still when residential care was not just monitored by local authorities, but was provided by local authorities. At that time, staffing levels were better, folks' involvement in gardens were much, much better. Over time, what seems to have happened is with the need for better funding of residential care, gardens for residential places have become grounds. Grounds, as I mean, with simple grass round and about, where there previously might have been gardeners who would have spent time with people. Now it's somebody coming in to cut the grass, if you're lucky and it hasn't been turned into car parks. I guess for me, I'm nodding along with what you're saying hugely about the need for both people in care settings and also the staff in care settings, that need for access to the outdoor world. Just to hear the birds when you open a window, to be able to see a bit of colour outside can make a huge difference, as we know and have always known, to everybody's day. I guess my question is, for the research and for publishing the research, that I don't think there'd be many arguments with the suggestions that you've made and the need for workers to be happy, to be able to provide better service to people in residential care. But as a gardener, I'm kind of thinking roots and shoots. And this piece of research I would kind of put in my shoots basket, that if it were possible, a wee bit more nourishment and a wee bit more care of the plant, yes, it would bloom better and things would be much better. From a roots perspective, I'm wondering, with this research being published, what will be the opportunity to look at the commissioners of care, as things have changed hugely in Scotland. It's now private care providers, it's businesses that provide care, and also thinking from point of view at assessing people's needs. Is access to outdoor spaces now on the assessment for people going into care, so that it's something they can say is part of their day-to-day needs going in? And is it something that the study will go to folks who monitor care, looking at care standards? Is the intention that looking at the value of access to the outdoors and access to therapeutic gardening can make? Thank you.
can I just say thank you, Elaine, for your question and for your sharing your experience. I'm going to hand over to Jenny, my colleague, who's actually supposed to be in charge of question and answer, and I'm going to take a back seat. Jenny, thank you. Autumn and Zoe no doubt have things to say, and Jenny, your floor.
Jenny, did you want to come in if you got a because I know Trellis is doing a lot of work on this. So did you want to say a bit about that, Jenny?
No, I'm fine. I was just wanting to facilitate anyone else that was
Okay.
anyone
Okay.
that you want to answer to and any more questions.
Sure. I mean, I know that Trellis has had a number of different projects around looking at residential care, and there is work afoot in terms of speaking to government around some of these issues, and there has been a bit of progress made with the inspectors as well. So we did have a little bit of a look at the inspection reports, which are starting to make note of some of these things around access to outdoor space. So there is a bit of a shift coming, but there's definitely I take your point about the need for these kind of higher level drivers of development. And it's an interesting one because when we were looking for care homes for Zoe to visit and interview, you know, it was interesting to see how gardens are used sometimes as a marketing tool in some of the websites. And I'm not saying that they're not being used, because that would be wrong to say that. I don't know, but I think it's trying to figure out whether that's how meaningful that is, you know, like, is it just a performative thing? Look, it's so nice we have a garden, but nobody gets out into it. So it would be a really interesting piece of work to kind of speak to some of the private providers about what they're doing. Sometimes in some of the kind of more well-funded private provision, you know, they are really developing very interesting and innovative garden design because they have money to pay for some of that, which some of the other providers don't. So that's interesting, and it feels like there's a piece of work to be done there. But I take your point about how the sector has really changed and the impact that's had on staff as well. So I think more work is clearly needed. You're absolutely right. So I don't think I've answered your question, but I'm kind of agreeing with you, really.
Thank you, Autumn. Julia, if I could just bring her in at this point, she wanted to add to this discussion. Julia, would you like to unmute and speak to us? And then we'll take hands up questions.
Hi, can you hear me?
Julia? No, sorry.
Yes.
No.
No,
Julia Swan? Julia Swan.
Her microphone's not working, Jenny.
Ah, right. Okay, thank you. Sorry, I'll just read out what Julia wrote then. This is to Elaine. She says, "This is such an interesting point, Elaine. I've mulled this over in relation to having outdoor natural spaces as part of regulatory standards, for example, with the Care Inspectorate. My thoughts are usually in relation to how it relates to children's rights under the UNCRC and the right to leisure and play, and how this could be achieved through therapeutic horticulture, and is often not upheld in residential or secure care for children." So it's a similar picture, I think, in residential care for children. So thanks for contributing to. Could I ask, I think, Mandy, you were first to have your hand up, Mandy. Would you like to go first? Ask your question.
Yeah, firstly, thank you so much for the presentation. I kept scribbling a question, and then the next time one of you spoke, you'd probably answered it. So I'm not sure I've actually got any very coherent questions, and they're very interesting points. I have written down that I'm going to slightly alter my advance directive for my children who are my powers of attorney to say, please make sure that you absolutely make some gardening happen for me if I happen to be in care without, capacity. So so that was a thought. I was interested about the whole risk side, and yes, we are so risk averse in social work and assessment, but I'm thinking I don't know, is there and I know there's lots of research done all over the place, but the risks of not being in the garden is, it's the two sides, and it's the mental health, but also the motor skills, memory. I mean, I do some one-to-one gardening work with people in their own homes. And sometimes, somebody with a diagnosis of dementia remembers what I've planted far better than me and and it's that looking forward to things. So even though somebody is older, you're not saying, oh, there's no point planting that. It's about, oh, let's plant this. I wonder what this is going to be like in the spring. So I was interested in whether there was any, in the people that you interviewed, whether there was any information about the reduction of risk.
I don't know, Zoe, do you want to come in here so that I'm not dominating this Q&A? Do you want to come in and say anything about that?
Yes, thank you. Thank you for your question. I think when we interview with our participant, I think that is the unique about the STH, because when we go into the garden and there is multi-sensory, we can smell and touch something, and this can stimulate people's memory, like you said, the dementias, and maybe it can stimulate their memory. And we fortunately talk about Annie, also a research about STH for dementia people, and we need to pay attention to the risk factors. Yes, I'm not sure I answer your question. Would you like to add something, Autumn?
That's okay. It wasn't a very specific question because you covered so much, and you did mention the physiological benefits and everything. So it's probably more of just, it's just great that your research is going to keep the discussion going. And I so agree that we kind of all know the benefits at some level, but you're, that bit about really digging into the mechanisms. Because unless there's that evidence, then of course we come up against the funding and the staffing, and
Yeah, and I think the thing is, it's interesting what you're saying too, Mandy, because I think one of the challenges in residential care, and I've worked more in children's residential care than adult social care, residential care, but I think that the habits and the kind of institutionalization can kind of drive practice. So often people don't intend to get in the way of things, but because they're kind of just settling into the way we do things around here, some of these things don't maybe immediately occur, and there's just a culture around not enabling it. So I think this is where we just need these culture changers, these people who really get it and are committed to it and keep coming back to it in whatever settings they're working with older adults. And I love the idea of putting that into your advanced directive, because I think that these are tools, and the point about that, actually the previous questioner made about assessment and whether assessments are addressing that. If we're making a holistic assessment of someone's need, a need to be in nature and in the garden is obviously a basic human need. So kind of noting that down, and we can do that in social work assessments and when we're thinking of matching people to residential placements, but obviously the care homes themselves can be thinking about that too. So that's a really interesting question. Thank you so much, Mandy. It's nice to see you as well.
You too. Thank you, everyone.
Thanks. Can I just jump in just briefly, because we do some work. We look at the care standards, for example, in Scotland, and try to ensure that they might include incentives to include gardening, a garden activity, as well as space provision in when inspection regimes are going along. And it's mentioned in there, but it's not very strong. It just says, some outdoor space, and it doesn't particularly give the incentive we would like to see. However, the Chief Medical Officer's report for this current year in Scotland has a whole chapter about access to nature and gardens and the importance for the health and well-being. And he exhorts us all to do more to make that possible, to make that happen and to incorporate it. So you could say there is change, because that's kind of the highest level of Scottish government. So it's certainly in the reports and the messaging externally. Whether that actually is performative or gets actually into the nuts and bolts of inspection regimes, we'll keep working on it, and time will tell. Sorry, that's my comment. Thanks.
Thanks, Fiona. I'll just pull out a couple of comments that were put in the chat here. Rowena Hughes was asking that in your literature reviews, did you find many studies performed in the UK? And do you think that studies in other countries, including Asia, are relevant to the UK? That was a question from Rowena.
Yeah, maybe I can answer this question.
Yes,
Okay,
thanks, Zoe.
thank you for your question. When we do the literature review, we found social and therapeutic horticulture is a broader, more conclusive term commonly used in the UK. So many studies is about UK, and it focuses on engaging people in gardening and nature-based activities to support well-being in a holistic and person-centered way. And in our study, we use STH to reflect the UK context and its emphasis on accessibility and everyday practice. And I think this question is very good about mentioned other countries. Yes, because our study is based on Scotland, many the mechanisms such as natural contact and social interaction, I think, are likely transferable. But implementation conditions may vary depending on culture, institutional, and environmental context. That maybe is the future research we would like to explore. Thank you.
Thank you, Zoe. Now, there is another question here in chat, and it's from Alice. Alice Chen, would you like to unmute and ask your question in person, or shall I just read this out? Alice, please unmute and ask it to.
Yes, can you hear me?
Yes, thank you, Alice.
Okay, so I just read off, thank you both for such a very insightful and interesting presentation. I was really struck by the idea of participation as a spectrum, especially the value of passive engagement with nature. And I was wondering, in practice, what tends to make the biggest difference in helping this kind of engagement become something that's sustained routinely rather than depending on individual staff's enthusiasm? Yeah, that's my question.
You want me to answer that one, Zoe? Yeah, you can come in if I suppose our kind of point about having it built into the routines of everyday care kind of speaks to this, so I don't know how many people have spent much time in care homes, but a lot of times the activities of care homes are all centered around the indoor space, and there's a presumption that that space is where everything happens. So trying to kind of move towards a presumption, recognizing the outdoor space as part of the available space, even if it's quite a modest area, a few chairs and a small patch of green, but that actually we should be regularly getting out there and what routine activities. So I was saying, like if you have a set tea time every day, like the presumption is we have our tea outside, and certain times of year we just do that unless it's pouring with rain, things like that, that if people get into the habit of it, then it becomes the norm, and then at least you're getting some day-to-day interaction. And then, thinking about a kind of more seasonal ways of engaging, that you could have like regular activities that relate to the garden throughout the cycle of the year, different activities that you might be able to do in the winter or in the spring or the summer, and trying to kind of, again, timetable those around festivals and other things that would routinely go on in a care home, so bringing nature appreciation into our celebration and our ritual rituals, which is what human beings have always done. And it's a weird thing we do now that we don't, so if you bring greenery into your house or a Christmas tree, all these things, all these rituals that we have at different times of year can help us look towards the garden if we're a bit more kind of aware and purposeful with it. But again, Trellis has so many great ideas for thinking about seasonality and ways to garden throughout the year and how you might bring those practices into the care home routines. So it's a good place to kind of check out, Alice, if you're interested in more of this. So I hope I've kind of answered your question.
Thank you, Autumn. And thank you for the plug for Trellis resources there. Always
They
welcome.
are really good. It's genuine plug.
Thanks. Well, there's loads on the YouTube channel, lots of activity sheets to download and for these kind of ideas. Now, Junier Lizou was had his hand up and was asking a question, but he's popped it in the chat. So it's a policy question he's asking. So if there's a gap between STH implementation and policy making, so if a country is suffering from aging residents, but they have no knowledge about the benefits of STH, how should we cope with that as policymakers? Very good question, I think. What can we do?
I think I'm guessing Jenny might want to say something about this as well, but Fiona might want to say something about this. But I think one of the things is that I know you don't mean this language, but I think we sometimes see our aging population in a negative way. And of course, our elders need care. Yeah, they need nurture and they need care, and they can't do all the things that they once did, but they're an incredible resource, and we owe them the absolute best because they're the people that have made our world. And many of them are gardeners, and all of them will have spent time outside. So I think one of the things is that we need to be more fierce in our advocacy for our elders and their right to nature and their right to gardening. And we need to point out some of the inconsistencies where we talk about person-centered care in one breath, and then we are very risk averse in another. And I think Trellis is obviously at the vanguard of that work in Scotland. But I think one of the things that will help is if we can bring the evidence to the policymakers and show that this actually makes people healthier. This makes care environments more peaceful and more positive, and it helps with staff retention and all of these things. So it's not just, oh, another thing we've got to do now. We've got to think about access to the outdoors. It's actually seeing this as solving a problem. There's a mental health crisis among older adults in Scotland as well. There's a care crisis, a workforce crisis, and actually maybe garden positivity, nature positivity, and engaging in that is one of the planks for solving this problem rather than seeing it as another issue. So I think that's kind of all our jobs, those of us who know what this evidence says and have seen it in practice as well, to be kind of speaking truth to power in whatever context that we're in. But Trellis is working very hard and has a lot of work going on with the government. So I don't know, Fiona, whether you want to say anything more about that, about some of the work that you're doing at the moment.
I will, thanks. That was really helpful. And I think I was also struck, like Alice, by this concept of the spectrum of participation. And I think that's really important to notice because if you give people a little bit of encouragement at the very earliest stages when they're maybe just getting curious, that can go a long way, and not just assume, oh, they're not doing anything, we won't bother giving them any help. That idea that just looking out and being a bit interested, nurturing that. We do that, where we can with care homes, but within care homes, the staff can do that with the individual residents. And then all the way up to the policy level, if we look at, how we move from people making comments in a chief medical officer's report about nature's nice, green's good for us, let's do this, to actually, okay, great, let's take that and let's actually put it into policy and implement it. That's a whole other level. So it's a really useful lens to consider this. We want it to be habitual, that's the goal, I think, because then it's strong. And I think and it's harder then for cuts and so on. Once everyone values it and says, don't take this away from us, we love our garden, it's much harder to then cut that, because people can see the integrated value of it. Once it's embedded, and once the culture changes, then it's a much stronger presence and it's much harder to take away. And I think that's a bit of a two-way street. I think it's a two-way thing with implementation and going up to policy level to support it. Because if you think about tobacco cessation and the law change, certainly in Scotland and the UK, the culture was already going that way. You know, people were already smoking less, and the health messages would be getting through. So the law came at a time when it was already acceptable to people, and it was a much easier transition. And I think if we work at two levels, you know, getting people to adopt this, have a go, start at the very early point of the spectrum of participation on the ground across care homes and seeing the benefits for themselves. And then we also work with government, because we've got these frontline projects where we are going into GP practice and care homes and actually working with them to run therapeutic programs, and then collecting the outcome data and using that to make a financial case to government to say, look, this is saving you money, look at these benefits, look at the value of them, this is really good for your whole nation, for your communities. So I think we're trying to work at both levels, but ideally a country wanting to see this become the norm maybe needs an organization like us that kind of is making that connection and collecting up all the outcome data and harassing government to listen and pay more attention and invest in it. I don't know, we're you know, we can't do this across the world, but I think whether individual practitioners have time to do this, great, but if not, it maybe needs someone to be making the case. But by sharing this research, that's half the way. You know, so much in this research is going to help us do that, and having that two-way relationship between practitioners and researchers, again, is something we really value. So hopefully that resource is going to help all of you make the case where you are. And just go back to Federica's comment initially, yes, the presence is used maybe performatively by people trying to win clients, but we need to show that it's actually something it's a no-brainer. You must have it, otherwise you're not going to compete with your other care home providers out there, and that it's really good for your staff as well, so that people don't need to be convinced they need it. It's kind of obvious that it's good for us all. Sorry, I've gone on a bit too much. There's 4 new messages and we're running out of time. We've run out of time already. Jenny, is there anything else we need to keep up in the question? Okay. Well, a huge thank you to you both, Autumn and Zoe. That's been an amazing presentation and it's stimulated so much discussion. So thank you for all of you for attending as well.